receive an email after the session with a link to the recording. So you will be able to come back and reference it again. And for those people who maybe weren't able to make it for some reason, they will also have the chance to still benefit from this session. So by way of introduction, for those that don't know me, my name is Jamie Myra. I'm the Executive Director at the Pulmonary Hypertension Association of Canada. I've been with the organization for almost 5 years now and have had the privilege of working with a great small staff here in Vancouver, as well as a board of directors across the country and volunteers, including some of the fabulous doctors and nurses you're going to meet with today from all across the country to help serve the PH community. At PHA Canada, our mission is to empower the PH community through support, education, advocacy, research, and awareness. And so hopefully you're familiar with us and you have a bit of a sense of how we do that. Today's session is going to be focused on a discussion of back to school issues specifically for families of children with PH. So I know that there's definitely some folks on the line today who don't actually have kids with PH, but who are from families who are affected by PH and have, similar questions or grappling with similar issues around the return to school for kids in the fall. And so we welcome you. Thank you for being with us. And we're glad that you found this to be a useful topic and that you wanted to join us today. So that we are going to be prioritizing questions from our PH parents, the ones who have kids at home with PH, who the session is specifically tailored towards. And we are actually in the process of planning a second session that will be a follow-up Q&A to one that we did earlier this year, specifically about COVID and PH. So this one is really going to be focused more on back to school issues. We are going to have time for questions, and then, like I said, the session will be recorded, so you'll have an opportunity to review it again later if necessary. So before I introduce our panel, I also just wanted to give you a sense of the kind of topics we're going to cover today. Obviously, when it comes to back to school and, in the era of COVID, there are, a lot of really valid and stressful concerns for families. And so, today, the goal of today's session is really not going to be to answer the question for you, what should I do? Because that's really not a question that, PHA Canada can answer for you, or that any of even our medical specialists on the line today can necessarily answer for any one family in this particular context. So while we're going to do our best to answer your individual questions, we will be, trying to generalize the conversation so that we can focus on giving people as much information and tools as possible to be able to make decisions based on your own personal circumstances, because everybody's circumstances are very different. And in particular, starting with the fact that, it's a big country with lots of different, jurisdictions involved, and every province is going to have slightly different, plans in place for return to school and protocols in place and things like that. So there's going to be a lot of unique circumstances that each family is faced with that we won't necessarily be able to get into the individual details of today. But we do hope that by having a general conversation about some of the most common issues and concerns, that you will be able to walk away feeling like you are a little bit more prepared and equipped to make this very difficult decision for your family. Of course, recognizing that things are also changing all the time. And so today is, but a sort of a snapshot of where we're all at, trying to figure out our way forward at a time like this. So to get us started, before I introduce the panel again, we're going to take an opportunity to just do a little bit of a poll and find out where folks are at. So on your screen, you should now see a poll that asks you where you're from. So if you wouldn't mind just taking a second and voting and letting us know where in Canada everybody on the line is from. Do people see the poll, I hope? The first question is about which province in Canada you live in. And then the second question, I'd like you to all just take a moment for yourself and think, how confident do you feel about making a decision about sending your kid to school or your children to school this fall? And then answer that question too. I'll give you just a few more moments to answer those questions before we close the poll. Oh, I'm getting a message saying it won't let people submit. So Laurence is on the line helping us with our technology. I'll ask her if she's getting any votes. Oh, she says I have to submit, but oh no, I can't do anything either. Okay. Oh, Laurence says some people are voting. So I can't vote, but it says I'm a panelist, and so that's why I can't vote. Some people are voting. So answer both questions, scroll all the way down, answer the first question and answer the second question, and then you should be able to submit. All right, so one more moment. All right, so I think we can close that poll low. Will it show us the answers? Can we see where our folks are from? Here we go. All right, so we've got about 25% of people are from BC, another 12% from Alberta. Nobody from the rest of the prairies, it doesn't look like. Then we've got about 50% of people from Ontario and some folks from Quebec as well. Welcome. And I don't see anybody from Atlantic Canada right now. It's a little late in the day there. All right, and then how confident do people feel? Well, it looks like right now, most people are not feeling super confident. Some people kind of in the middle, feeling a little neutral, but for the most part, people are not feeling particularly confident right now. So, all right, well, that's really good to know. We totally understand where you're coming from. Like I said, we understand how stressful this decision process is for all of you, and that's why we're here to have this conversation today. So let me take this opportunity now to introduce our panel. So first, we're going to hear from Dr. Andreea Dragulescu. I hope I'm saying your name mostly correctly. I apologize if I'm not. She is a PH specialist in Toronto at Sick Kids Hospital. She will start us off. Then we're going to hear from her nurse practitioner, also from the Sick Kids PH clinic, Janette Reyes, who many of you probably already know as she's been working in PH for a long, long time. She's also a board member at PHA Canada. And then we're also going to hear from her colleague, Sue Richards, who is the nurse practitioner at the Stollery PH clinic in Edmonton, who serves Western Canada. And then finally, we're going to hear from Dr. Anne Fournier, who is the PH specialist from the Pediatric PH clinic in Montreal. All right, thank you all of you for being here today. You may notice that we are missing one person. We are missing Dr. Angela Bates from the Stollery. She was unfortunately unable to make it back from her vacation in time, but we wish her well while she's traveling today with her baby. And yeah, we'll hope to see her at another time. So I'm going to now mute myself and invite Dr. Dragulescu to take over.
Hello. Thank you for the invitation to be part of this panel. And yes, it is a very important topic to discuss COVID and in this difficult group of patients with pulmonary hypertension and the return to school, which, as we've seen in the poll that you've put up, most families are not very confident of the decision that they're making. The Sick Kids and Ontario in general have put up some recommendations that Jamie will share some links and a PDF document at the end of the session that I encourage you to read. There's quite a lot of information in there and very good information put together by a large panel of people with broad areas of expertise. What I can say overall, I'm not an infectious disease specialist. I do know about pulmonary hypertension. I do know about pediatric cardiology, overall, I say that we can say that there is increasing experience in children with COVID-19. Overall, it seems that children are less susceptible to the infection and maybe less likely to transmit the virus to others. the younger children even less than the older ones. And as I mentioned, there is a lot more information on those documents that will be shared with everyone. I think that any decision about returning to school should be individualized and should balance the children's health, including considerations about promoting normal activities of childhood as much as possible, as well as mental health. And on the other side, minimize public health risks. I think until now, there's maybe not enough data to say that children with congenital heart disease and or pulmonary hypertension are at a lot more risk than other children of the same age, especially if they are otherwise healthy. Overall, I think the immune system of patients with pulmonary hypertension is more or less within normal range. So from our point of view, from Sick Kids and our group, I think the recommendations would remain the same, to follow the government, the public health and the school board recommendations. As I mentioned, a lot of time and thought has been put into these recommendations, but by people from a lot of different areas of expertise. And wherever you are and wherever you decide to send your child to school or be home, it should be based on how these recommendations can be met. And from our perspective, there are no additional specific requests or recommendations to make. Overall, I would say that patients with pulmonary hypertension should be able to return to school in person within the guidelines set out by the school board, the public health, and your local school. And you have to remember that even healthy people can get very sick from regular flu and or the coronavirus, even though in the majority of cases, especially in children, the symptoms of infections are fairly mild with full recovery. So yes, it's not a black and white decision. It's not a clear solution. But I think following these broad recommendations of people with a lot of expertise in different areas like epidemiology, infectious diseases, public health, etc. It's we should follow those recommendations and here to help you and to support you in the decisions that you're making.
Great. Thank you very much. So we're gonna go through the rest of the panelists and then we will come back to you for questions, but thank you very much. So I'm gonna turn it over to Janette next, who I think will speak more to what some of those recommendations are, at least specifically in Ontario. So Janette, if you wanted to unmute yourself, you're up.
Thanks for reminding me there. Okay, so I'm just going to do a brief intro with the relationship of what the recommendations and why they came about. So just to give you an idea that the documents, the link that Dr. Dragulescu and Jamie will be providing you is a document that was originally created by the Hospital for Sick Children and Unity Health Toronto. And it was to help guide schools to reopen to provide safety to the students. And then further refinement of the document was made by other pediatric hospitals and experts to provide the child maintain the best health that they can have at school and minimize risks. And so this is also in keeping with the support of the American Academy of Pediatrics, Canadian Pediatric Society, and European Academy of Pediatrics, who state that it is important for children and youth to return to school because education is, as they quote, absolutely critical. And education is essential for a child's development, as you know, and it is a human right. And in this case that we are currently going through right now, the benefits do outweigh the risk. And just to provide you an update, across Canada first, as of July 27th, there have been 7.5% positive cases in children and youth 0 to 19 years of age. And those that were infected were asymptomatic or only had mild symptoms. According to the president of Sick Kids today, he states that out of 10,000 samples performed here, only 0.7% were positive. And 15 children were admitted, but they've done well, and some of them were admitted for non-COVID issues. So that's just to give you a background as to where we're at right now, to hopefully help you as well as the parents and guardians to make a decision for your children. So I'm not going to go through the whole entire document, but just to let you know the importance of screening when your child goes to school. So we're not here at Sick Kids, as you know, we perform screening for all visitors. For school, they are counting on the parents to do a pre-screening at home. So don't send your child to school if they're feeling unwell. There is an online from the ministry, a COVID assessment that you can also use for yourself and for your child to give you an idea and direction as to how you can proceed should they have certain symptoms. I thought I'd share it with you just very quickly. So Laurence, if you can show them. So this is the website. If you go to this website, it will take you to, next slide. Do I do it or? Oh, sorry. This is just a document on how you can teach your child how to put on a mask properly. So we can provide you this document as well. But I thought I'd share this with you. Okay, the next slide. So when you do click on that website, this is the first screen that you'll see. So it's going to ask you questions and you say yes or no. Next slide. If you say yes to those symptoms, which are severe, this is what it's going to tell you. Call 911, go directly to your nearest emergency department. Next. And then if you say no, you don't have those immediate symptoms, they'll ask you, oh, this might be, sorry, this next slide, please. Sorry, it'll next ask you these symptoms here. So fever, chills, and you can just tick off as many as you can, or that relates to your child. And then next slide. And then there are more, again, symptoms, and then you press continue. And then it will ask you the age, which was the previous slide. And then it'll ask you, when did your symptoms start? And then again, you click this. Next slide. And then it'll give you guidance as to what to do next. Whether you go to the nearest assessment center, and in your child's case, call the pediatrician or public health. And that's all. I just want to give you a background as to that, and then we can address your questions related to the document and support them accordingly with the document.
Okay, well then I'll turn it over to Susan to see what she wants to add from Stollery's perspective, and then we'll come back to some of those more specific recommendations about protections in schools and things like that in the questions. Okay, Susan. Susan, you're on mute.
Just undoing it here.
There you go.
Okay, so good afternoon, everyone. So here in Alberta, we don't have any individualized recommendations from Stollery or from AHS. It is they put it through through the Alberta government with the health minister or in the education minister, and as well as our doctor of like Dr. Dina Henshaw. So there's documents on Alberta, COVID Alberta, which will give you all the plans of what is being instituted in the schools for the return of schools. And as you know, it was initially rolled out in July, and with more evidence that masks are beneficial and the bylaws where we're wearing masks out in public in a lot of places in Alberta, even down to very young ages, returning to school, it's mandatory that a grade 4 to grade 12 will be wearing masks, except when they're in their classroom, but the teachers and all the staff members will have a mask on all the time. Just like when we go out in public presently, that is mandated or you're fine. They also have put out very specifically about the hand sanitizers, what is going to be expected. You know, any child coming to school that has any symptoms will be in the parent will be immediately called to pick up the child. And also every school will have non-contact thermometers to check children out if they have been. If there's a positive COVID in the classroom, they haven't rolled out the plan of how that would look. However, there is isolation requirements on that website, what it means, like what you would have to do and what is mandated by law in Alberta that you have to do if you are in contact with a suspected COVID person. So those guidelines will be followed very closely by the school board, by the teachers, and the masking. Under grade 4, so grade primary or kindergarten up to grade 3, masks will be optional. There has been hand sanitizers funded for all the school with like a very 466,000, so 100,000 liters of hand sanitizers that are going to be divided between all the school districts. So they have, and 2 masks are going to be provided for each child, free of charge, reusable masks. And so they're trying to have this all ready for rollout beginning of September. So I think some of those safety things that they're instilling in school is some of the things that we've been fighting for, even with the common flu, with H1N1, human metapneumovirus, where we have been asking the teachers to have hand sanitizers in the classroom, or kids not coming to school if they're sick. So I think in some sense that is reassuring for other influenzas for the fall as well. The other thing I would strongly recommend is that we continue, as we always do, is recommending our flu shot when that comes out this year as well. And that's, and then kind of the slides that Janette posted as well. Okay.
All right, thanks, Susan. So Anne, I'll turn it over to you, and then we're going to open up for questions. We already have some coming in. We have some that came in prior to the session as well, but I'll give you a chance just to say your piece, and then we'll open it up for some questions.
Thank you, merci. I just want to end what said Andreea about our when we started, all pediatric cardiologists were very worried what will happen to our patients, you know, our sicker patient, including patient with pulmonary hypertension. And all the pediatric cardiologists in Canada got together and we made a surveillance program of children with heart condition who underwent COVID. And during the first 2 months where the infection was the most important case, and in Quebec we had a lot of cases, as you know, we found only 5 kids in the whole country who had a heart condition and developed COVID. And none of those 5 kids were hospitalized, and none of them suffered from their disease, and they all recuperated very well. And 2 of those kids were very sick kids who had what we call the fontan palliation, meaning they miss half of their heart, and we didn't have any patient with pulmonary hypertension. News are very reassuring news. So follow that, Janette in Quebec, schools reopened in the spring outside of Montreal. Elementary school children all went back to school, and things went very well. You know, they washed their hands, they wear masks outside, and then kids are they are much better than adults. You know, they listen to rules, and this is the way things are. So we have to trust our little ones. They are better than we are. And everything went very well. So now for next fall, they are discussing what are they going to do with the older one for the secondary school. Everything's going to reopen, but will they ask for a mask or not and things like that. So this has not been decided yet. In Quebec province, we have the Association Québécoise pour les enfants malades du cœur, en cœur. It's the heart foundation. So every child who have a heart condition, and this is the same for children with pulmonary hypertension, because often the heart is involved. They are part of this foundation, and all the information is on the website of the foundation. They even prepare a very nice mask with encre, and they give to the patient, and so they're very proactive. But so far, so good, and we just cross our fingers. And as everybody says, schools is important for all the children. So to refrain them from school maybe do much harm to let them go. But every time the decision has to be taken between the families and the treating physician. And we cannot make big rules, you know, a child with pulmonary hypertension cannot go to school. No, this is not right to say. And this decision has to be taken with the family and the treating physician.
Okay, thank you very much. All right, this is great. We've covered a lot of ground already. We have a lot of questions coming in. So I'm going to do my best to sort of group some of these questions together so that we can get through lots of different topics. So I'm going to start with the question of masks. And actually right off the bat, I'm going to, we've got a question here about some of the conflicting information that's going around, you know, whether it be in the news or on social media or, you know, just even on our personal networks. You know, people hear that wearing masks for a long period of time, especially children wearing masks for a long period of time, can be bad. So I've got, Anne is already shaking her head. So Anne, why don't you take this question? Can you answer for us, good or bad, kids wearing masks for long periods of time?
There was a lot of reports about masks, you know, you're gonna choke. And then some patient told me, when I put the mask, I got asthma. Have you ever had asthma? No, never. But I have asthma with a mask, you know, come on. So it's not fun to wear a mask. This we know, we're wearing masks every day, but there's absolutely no harm to wear a mask. Your oxygen level will not decrease because you're wearing a mask. So mask is there to protect yourself and most importantly to protect others. And if everybody wears masks, this is where we get the best protection. So mask is not harmful for you, and you have to wear it. Of course, a little one, this is very hard to decide, and they wear it under the nose and they play with it for sure. But kids, as I said, are wonderful. And if the mask is mandatory and if they have to wear a mask, say in crowded areas, they will be able to do it.
What kind of recommendation would you make for a parent whose child perhaps in addition to PH maybe has neurological differences or a mental health condition that makes wearing a mask or expecting them to consistently wear a mask very, very difficult? What other steps might they be able to take?
Stay distance. If you cannot wear a mask, the mask is there when you closer than 2 meters, you know, that's always what we said, 6 feet. So if you cannot wear a mask for any any reason, because it's really uncomfortable, then you try to keep the distanciation, the 2 meters distance, but it's not always possible. And kids, they like to close to each other. That's normal human behavior to each other or being close to each other.
Great, thank you. Okay, so thinking about masks and the idea of wearing things all day at school, let's talk a little bit about oxygen. So we've had some very specific questions about oxygen in particular, so maybe I'll throw these over to Sue and Janette. One question is, in the context of returning to school, should families be using an oxygen concentrator at school, or should they be using portable tanks instead because of COVID?
So here in Ontario, it will depend on the school as to whether they'll allow a concentrator versus oxygen tanks. So we've had schools where they will only allow oxygen tanks for portability reasons as well, but it will depend. So speak to the school, speak to the teacher as to what they will allow. It is possible, the government supports that whatever is needed for these children, that they try and accommodate.
Okay, so then presuming they're using oxygen in schools and they've perhaps got long tubing to move around, should they continue to use the tubing, or if they are using tubing, what should they do to perhaps keep it sanitary, disinfect it while they're coming back and forth between school and home?
We use to clean our tubings here, you can just use the alcohol, minimum 60% alcohol. And then if you can avoid, if they're sitting, just roll it, avoid it from touching the ground. And then if you can try to as much to avoid that, then, and minimize the, having to have to clean it, stop what they're doing and cleaning it, then having tubing in the classroom is possible, or just keeping in that particular area of the classroom where the child can sit and sort of be aware of who's been in that area as well.
And then finally, thinking about oxygen use and mask use together, any tips for parents for helping their little ones using oxygen to also use masks? Anybody?
So if they already have the oxygen, that's certainly helping them as well. The mask is providing them a different type of protection, and more so in avoiding droplets, again, like the COVID droplets or aerosol that's around their area, that's what it's for. But I mean, having the oxygen, it shouldn't affect them, because if anything, it's helping them with their oxygen saturations. Sue, I don't know if you have anything else to add.
Well, we've had children on oxygen and quite unwell with pH, where just like our traditional flus, influenzas, have been worrisome, where kids are coming to school unwell, where they've already been using masks in some of those settings prior to this year and COVID, and without difficulties, right? So
the oxygen, the nasals and the tubing.
And then they had the mask on as well, just to, because at that point we were struggling to get hand sanitizers in the classroom for people to wash their hands in between blowing their nose and stuff. And that was a struggle last fall. So in every other fall, right? So this year, that's one less struggle that we'll have. With the oxygen tubing, I would suspect that the cleaning or keeping or wiping it down should be coming also from the respiratory company. There should be a standard of how you clean the respiratory, like a trach vented patient, there's certain standards in cleaning and what solution you use to wipe it down. And I would follow what they should have guidelines as well, the respiratory companies.
Okay. So thinking some more about how some of the difficulties around face masks, acknowledging that not, small children, maybe consistent use or proper use might be a challenge, or for some folks, just, sensory issues or discomfort or anxiety might be a barrier to using masks consistently. We have a question around masks versus face shields. So when are face shields going to be an appropriate addition or alternative perhaps to masking? Andrea or Anne, maybe?
I can answer it.
Sure.
Yeah.
So there really isn't a lot of evidence that the face shields will alone will avoid any transmission, but the mask itself is what is mandatory. It is an option for students and teachers to wear the shields if they like. So if the parent wants to send their child with a shield in addition to the mask, then they can.
Okay, and so then just thinking about this idea of shielding, we have a question about, so we talked about how masks are really important, specifically when distancing is not possible. Thinking about classrooms and classroom sizes and classroom configurations, we have a question from someone who says that their child is normally in a configuration where they sit at a table with other students. Would it be a reasonable accommodation to request that a student in that situation be seated alone and not be seated next to other children?
I don't think so.
You don't think so?
Yeah. If all the children at the table wear masks, and even if they are less than 2 meters apart, I don't think it's reasonable to isolate a child just for that. I don't know, Anne, if you think differently.
I would not, like you said, imagine this little one, they are put aside, it's going to be very difficult for them. So if you decided to send your kid to school, they have to be part of the game. And also what's the word, the hockey player, they are in a bubble, is what you say in Ontario now. The hockey players, they are in a bubble in Toronto. So they say that they will use the school, like the classroom, as the bubble. So the child will be, they will keep the class as the bubble. So the child has to be part of his class, but they don't have to play with the kids from other classes and then in bigger schools. So I would not recommend putting his child apart, not at all.
A couple more questions. So we have lots of questions coming in, a couple more questions coming in about masks. So first, maybe a simpler question. Any specific recommendations about types of masks? Are reusable non-medical masks considered appropriate in this context, or should it really be like an N95 style mask?
I'd say any mask is fine.
Any mask is fine in this context.
Yeah,
Definitely
and
not.
N95, they are good for a certain amount of hours. So after a few hours, the N95 doesn't bring you the security you have when you wear it right away. So N95, you keep it really when you intubate a very sick patient, but for protection in school, any mask, as long as the child accepts to wear it.
Okay.
And we got to realize
N95 are not comfortable.
No. We also have to realize the mask, we're wearing the mask to protect others from us with coughing, sneezing, with those etiquette. The other person is wearing it to protect you. When you wear an N95, that is more a mask that is protecting the person, like the surgeon or the person that may have a high load of it. So the mask is part of helping decrease the spread of it, and it has been newer studies coming out has shown that this is an adjunct to the good hand washing. It doesn't take away that hand washing, very important, sanitizing when you're touching things, and the social distancing is all there. The mask is present as well in conditions where you can't. So one of the questions where they say you can take off the mask when you're in your bubble in your classroom, you can leave it on as well, and in that situation, or if you're sitting at a table where you can't, right? So those are some of the guidelines, and all of the masks are going to be provided per students, and they'll be reusable with guidelines for all the students in Alberta, and all the staff are getting them as well.
So It's important to recognize that in not all, the protocols are not the same in all jurisdictions.
No, exactly.
So for instance, you're speaking specifically about Alberta, yes. For instance, right now at this time, masking is not mandatory in BC at all. So no, not in indoor public spaces, or it's not going to be mandatory in schools either. So generally speaking, would your recommendations around attendance being beneficial and, being preferred, on the whole being preferred, would that change for you in a jurisdiction where masking is not mandatory?
I would say no. There's a reason why BC decided not to put the mask mandatory. It's because there's no COVID. In Quebec, it's mandatory inside because we were overwhelmed with cases. So I think the incidence of the disease is also important to consider in the decision, and the family has to take this in consideration when they make their decision to send their child to school.
Okay, thank you. All right, I'm going to switch gears just a little bit from talking about masks and talk a little bit about siblings. So obviously, PH is not something that is experienced in isolation just for one child. This is something that affects an entire family, and parents are really making decisions. Parents and guardians are really making decisions not just for their PH kids, but for all their kids. What advice would you give to parents around, the decisions they need to make for their PH kids versus siblings? Is it really, does the behavior really need to be the same for everybody? Or, can you treat one kid differently than the other in this situation?
So I think it's going to depend on, again, the severity of the PH and how much isolation that child will require, or educational assistance that the PH patient will require, whereas the sibling won't need that much. So I think sending both to school, but yet also putting more responsibility on the child without PH, the proper hand washing and safety precautions, they should also do that as well. And then with the child with PH, we need to focus, tend to speak with the teacher and the school to put things in place, to put safety measures in place. Perhaps they need a separate classroom with fewer students where they can study together as a cohort. They can develop their own cohort for children with other special needs.
So if that was a type of accommodation that a family might need, is that something that a PH clinic would potentially get involved with advocating for at a school level?
Yes. So just have, the parent, we're happy to write letters or have a discussion with the principal and teacher as to what we can put in place to promote safety for the PH patient, and as well provide some guidelines as well for the sibling to go back to school. I mean, we can't, it's kind of unfair to keep the other sibling at home who doesn't have PH, and at the same time, anyway, we should encourage our PH patients to go to school.
So in some jurisdictions, online learning is going to be an option in addition to in-class learning. And so some families may see in online learning at home as a more reasonable approach for their family, given the concerns that they might have or the risks that they might feel that their family has. In a situation like that, where online learning might not be available to them, but that's an accommodation they might be looking for, is that another kind of reasonable accommodation that PH clinics would advocate for students? Or as you're saying, generally speaking, you would prefer to see kids as much as possible in class?
No, I think, well, here in Ontario, online learning is an option.
It's not an option in all places, though. For instance, like BC, it's
okay.
right now. So, is that, maybe, I don't know, maybe Susan, that's a question for you. So for instance, if a family in BC really felt that online learning was the accommodation that they required, is that the kind of accommodation that the clinic would help advocate for families?
Well, I think we would have to look into even the number of positive cases in that area, right? Because there are areas that have 0 cases, like usually like Edmonton, Calgary, they're more of the urban areas will have it. If there's a high number of cases, like we've had a spike, and we've changed our mandates from July 21st to August 4th to go without needing a mask to needing a mask because of the surge that we've had. And from more recent studies, right? I would have to see what the school had in place and kind of what their numbers is and what kind of where the information where we have it from, okay, you're going to wear a mask, you're going to have to hand wash, you got to have it on for social distancing. And if they're not following kind of the same practices across the country, you're going to have to maybe help support them on why that's not happening in the schools and try to understand some of the mandates in a province like in BC as opposed to in Alberta.
Right. So in BC, you know, our provincial health officer has stated that she does not currently feel that mandatory masking is required. So, I mean, you know, when we say there's quote, no COVID in BC, obviously that's, you know, that's a simplification. We do have COVID in BC in some locations, and we have seen a recent uptake like most jurisdictions have as things start to reopen a little bit. So what I hear you saying is that, you know, really, you know, it's going to depend on the specifics of someone's situation, not just their child's particular health circumstances, but also perhaps why a school or a district has made decisions about what kinds of learning are going to be available.
And I would utilize, and I have, like our pediatric lead infectious disease physician, because I mean, COVID is the same across the country, and to have different, to try to add into my letter, right? Why this would be important for this particular patient too, because with, and use evidence that we have found so far that would support, okay, social distancing, good hand washing and masks, all in adjunct would make the patient safer. But remembering that wearing a mask in that situation is to protect you, like not you, but other people from you. So you wearing a mask is not gonna protect the other person or the online. So then we would have to, I think, weigh out every case individually. Why? Because we're all gonna be, as things open up, everybody's gonna have their own anxiety because we're not gonna know what's gonna transpire until it happens. And that's the unknown, right? So it is anxiety provoking. But the thing is, we have not had any in Alberta, even with our numbers, we have not had any child admitted to hospital with COVID.
Okay, looking at our questions here, I want to go back a little bit. We can come back to more questions about masks if we need to, or other specifically school-related questions. But we had a couple of questions about COVID so I thought we'd maybe go back a little bit to some of the discussion at the beginning. There was one question in particular about, many of us have heard that the correlation or the potential link between COVID in children and Kawasaki syndrome, or this multi-system inflammatory syndrome like Kawasaki. And I'm just wondering if somebody can comment whether or not we've seen any cases like that in Canada. Maybe Anne, I don't know if you have an answer to that question specifically. And then the second part of the question is whether there's any potential correlation between those cases where that has happened in children with COVID and other comorbidities like, not necessarily PH specifically, but like PH or chronic heart defects, things like that, or congenital heart defects, things like that.
So there's absolutely no link between this Kawasaki-like syndrome and PH and any heart condition in a child. So that happened in children who had the COVID and then they presented with this kind of syndrome. And this is how the Kawasaki syndrome also is not a syndrome we see in children with heart condition or pulmonary hypertension. There is a surveillance program. This is led by the people at the Sick Kids on this syndrome in Canada, and I think there's been very few cases. You know, I think I've heard about 1 or 2 in Montreal, and they were not even sure that this was really the problem. So it's very rare, and we don't see that very often, and you don't have to be worried if you have another condition like pulmonary hypertension.
Okay, thank you. The next question is about, we talked about screening, the importance, Janette mentioned at the top, the importance of screening, and that parents will be responsible for screening their kids, not just their PH kids, but all their kids prior to going to school, and that there's going to be a bigger emphasis on ensuring that anybody with symptoms in the school in school are sent home, similar to workplaces, really, this push that when we're sick, we stay home. So the question is how effective is temperature checking with respect to it being an indicator of whether somebody is contagious with COVID? Anybody feel able to answer that question, Andreea?
Yeah, I think that the temperature by itself will tell you that the patient is necessarily infectious or not. Of course, if a patient has temperature, definitely has to stay at home. If there are other symptoms with the temperature, runny nose, headache, abdominal pain, whatever, respiratory distress, of course, then they should seek medical guidance and be tested if they have the virus or not, or another virus for that matter, more likely. But the temperature in itself does not tell you that you have COVID and that you are infectious of COVID.
So is this why I'm not aware of any jurisdiction, for instance, where temperature checking, for instance, would be required upon entry to a school. So this would be why perhaps that might not be part of the recommendations for schools, even though we may see it in like a restaurant might do it, or you have businesses out there that are implementing these types of protocols. So it's understandable that parents would say, well, why do I have to have my temperature checked to pick up sushi if I don't have to get my temperature checked to enter a school? So is the temperature check protocol generally not considered super effective? Is that why it was not included in school recommendations?
If a child has temperature, it's likely that they have some virus or something, not necessarily COVID. And then, yes, before you know what exactly is going on, that child should stay at home. You don't really want to send the child with fever at school. So yes, even if the school doesn't mandate to check the fever, if the child is warm at home, and parents with children should have a thermometer at home, and he has a temperature, then you stay at home.
In Alberta, each school will be supplied with 2 non-contact thermometers for the teachers, staff to use at their discretion. So if there were symptoms, they can, and the parents will have to know that. In each school, anybody entering the school will have to do a self-screening questionnaire every day. And even a visitor that comes to the school or come to pick up a kid for someone will have to do the same questionnaire before entering.
Right. So go back to Janette's point, though, that screening protocol is really the responsibility of parents and something that parents need to be doing.
Yes.
Yeah. Okay, I think just looking at we've got a few minutes left. Just looking at our questions here. We had, I think this is sort of a couple questions related to this idea of, okay, we've talked about kids with PH, but we recognize that often kids with PH also have other complex health needs that are not just PH. So if you have a child who has PH and has, say, some other kind of chronic lung disease or some other, major chronic illness, do your recommendations sort of in principle change at that point? Or do they really remain the same? And again, it comes down to, looking at how to apply the recommendations to your personal circumstances, regardless of what condition your child may or may not have.
Usually, if a child has many conditions together, the heart, the lungs, very sick, they are followed by many specialists. So usually for taking this decision, which is a very important decision to send a child to school or not, we get together and we discuss, because those children are not the majority of the children we treat. And when they have many conditions, and probably the sicker organ is the one who's gonna lead the discussion. So if, say, the lungs are much more sicker than the heart, then the lung specialist will help to make the decisions more than the PH specialist. So it's going to depend on every child. Children with neuromuscular disease who also have lungs condition and muscle condition, and all together we discuss the cases to decide if they go back.
So mental health wise as well, even in support by our associate chief here at SickKids, those children with a lot of chronic issues as well, they are also the ones, most importantly, we should try to assist them in going back to school, provide them all the support that we can, because they are, if any, probably more affected psychologically and mentally, because they already have other chronic conditions that they have to deal with. And then to have to not be able to go back to school would add on another issue.
Okay, I've got a couple more really specific questions, so I'm going to, hopefully we can get through these in those last couple minutes. So we've got somebody here who says, I provide my client with Ventolin Pulmicort treatment via nebulizer, which is aerosol generating. How far does the client need to be away from his classmates in order for the practitioner to do the treatment? Does he have to be should the client be in an entirely different room to protect the students around? Or is there a particular distance that you can provide? Does that question make sense?
Yeah, so for our patients, although we have had patients prescribe them aerosolized vasodilator or pulmonary hypertension medication. For that, we always suggest a separate room, a separate ventilated room. And the person or the guardian, who, if they have to stay in the room to supervise, they were to be wearing a PPE at the time.
And that's this, yeah. That's exactly the same policy out here.
Mm-hmm.
Okay, so my understanding from what you're saying is that a separate room, the child and the practitioner, and anybody else like a guardian that might be in the space as well would be expected to be in full PPE. Presumably the provider would already be in PPE, correct?
Yeah, like when you're doing it at home, so if they have these treatments at home and that's your bubble and they've been doing it and you're intermingling, that's one thing about what but if you're in the school and you have an aide or someone else, that anything that can throw droplets, so even positive pressure ventilation, that's going to be a little more, because in the hospital, if you have an open system or it's going to get open, the person that's opening it should have full like N95, the gown and the whole bit. So we're going to have to cross some of those bridges if we have patients in school that have trach vented and have PH, because those are the guidelines within that the caregiver here would have to follow, like if they're non-family.
Right. Okay, couple really quick questions. What's the best place for using a thermometer? Contactless on the forehead or in the ear, or should you be using something under the tongue? What's the best kind of thermometer for doing this kind of screening? I have to do this for my daughter for daycare every day, so I'm curious too.
Well, if you're talking about families doing the screening at home, whatever thermometer they have at home will do. If you're talking about screening made in public places, of course, the contactless will be the best one, because you don't want to take a thermometer from one person to another.
But at home, really, anything you have available should be sufficient for doing screening at home.
Yes.
Okay. All right, this one I'm going to read it the way it sounds because I'm not entirely. It says, do you recommend a proactive doctor's note re medication side effects like headache or diarrhea? Should we always err on the side of caution, or should we always err on the side of caution? So, for instance, they know that that certain medication increases of Uptravi, Remodulin, whatever, can cause these kinds of symptoms that can also be could potentially be mistaken for COVID symptoms. So, should parents, sort of just send a doctor's note that says, oh, if my kid gets, a stomach ache or a headache, it's probably their medication, they can just take this? Or is that going to be a reason to send them home and have them tested for COVID?
I think the parents have to communicate. Certainly a letter will help to address that these symptoms are not new symptoms. So just like in the assessment, it's going to ask you how long have they had these symptoms. So if the child hasn't had diarrhea in months, and then whether they're on that medication or not, and then all of a sudden they have diarrhea with some abdominal symptoms, then that's something that's different and should be addressed. But the letters, absolutely. If diarrhea is a constant side effect because they're on Remodulin or other medication, then that should be noted that it's common to expect it.
Yeah, great. Okay. All right. Well, I think we've gone through most questions. It's exactly 3 o'clock. There's one more question that I think is rather difficult, and so I'm going to end with it, not because I want to end on a bad note where we don't have a real answer, but I think it is something that's weighing on people's minds. In jurisdictions where the recommendations from places like Sick Kids don't match up with what they feel like are the actions of their ministries of education, so for instance, if the recommendation is that class sizes should be small, but instead they're bringing return to school at normal class sizes, does that change anything in terms of what we've talked about? Or, are we all recognizing that, the recommendations for what we do in a perfect world and the recommendations, the guidelines for how we can practically operate schools are never going to match up perfectly necessarily? And as we've been talking about, families are going to have to weigh the risk and benefits of, their children being in school beneficial versus, potential risks of, realistically, not just COVID, but, other infectious diseases, flu, whatever the case may be. So, if people feel like, oh, I don't think my school really listened to, public health officials or Sick Kids or whomever in making this decision, should that really shake people's confidence? Or is that just, we're just going to have to kind of reconcile these things as we go? What do people have to say about that? I know it's a tough one, but I see you smiling, Andreea. Do you have anything to close us off with?
Well, it's definitely a tough one, but I think I would go back to what Anne was saying earlier, and it depends where that school is and what's going on virus-wise in that particular region and why the school made that decision. They didn't make it just by themselves because they don't care or they don't want to apply guidelines, or so yes, it is a balance of really what's going on in that particular area and what the school can do and can afford to do. And all these measures require a lot of money to be put in place. And yes, the risk benefit for that particular child, again, particularized how sick that child is, how much higher the risk. As we said, these children don't seem to be at much higher risk than regular children. So not sending them to school might put them at higher risk of other problems in the long term. I think, yes, it's a hard question to answer, but yeah.
The other thing the families should remember, the teachers and the staff working there are adults, which are at a higher risk of having hospitalizations and being quite ill if they pick it up from a child or what have you. So they're going to want to follow. They will have the union, if they're in a union, or they will have the labor board after the school board or with the government, and they will be reporting it if standards are not met. And it will be addressed, it will have to be addressed, because they will be more of the people that would be exposing that to the public, that the standards aren't being followed. And so I think that every school and every teacher and the staff within there, as well as the school board, are working very hard to stay within the health minister, as well as the physician, the lead in each province, to stay what is mandated in there. And because we got to remember, the teachers may be the higher people at risk with their being adults, right? So they will, I would suspect that they will ensure that all the standards and safety measures are put in.
Great. All right. Anybody else have anything, any final comments? We're just a few minutes over, so I do want to wrap up, but any final comments from our panelists? All right. Well, thank you very much, all of you, for your time and your expertise. We really do appreciate it. This is a very difficult topic because there are no clear answers. You know, this is a difficult decision for families. So I want to encourage you to continue to, you know, reach out to each other to support one another, to continue to reach out to me and to PHA Canada, because, you know, we are here to, you know, sort of walk with you on this journey, even if we don't have all the answers either. And then of course, especially if you have specific concerns about your own family circumstances and you're not sure how to apply these guidelines to your own particular circumstances, that is what your medical teams are here for. I know that they are willing to have this conversation with you. And obviously they'll keep having this conversation with you as the circumstances continue to evolve and to change in all of our jurisdictions. So on that note, I wish you all a lovely summer evening. I want you to enjoy as best you can, you know, these final weeks of summer before you do have to contend with you know, a return to school and all that comes with it. Stay safe, everybody. Have a wonderful evening, and thank you. Oh, wait. Oh, Laurence just reminded me that we actually I have three housekeeping things I was supposed to do. I was trying to wrap up. All right, we have a very quick poll. I would like, if you can, to very quickly take 30 seconds, 10 seconds even, and just answer the one question that's on your screen. And while you're doing that, I will let everybody know three things. As soon as you log off from this, from the session, as soon as you hit leave, you're gonna get a pop-up on your screen that's gonna invite you to take a very brief survey, like it'll literally take you a minute to complete. We invite you to please give us some feedback on the session by completing the survey. Second, you will receive an automatic email from Zoom that will have a link to the recording in it if you want to revisit anything in the session. And then three, you will receive a follow-up email directly from me that will have some resources in it that were shared by some of our panelists. So I will send that out to all the people who registered separately, so that you receive those resources as well. And then you can always follow up with questions to me again. All right, Lo, let's see. Are people feeling any better? Yay, look at that. We almost flipped it. People are feeling much better now. That makes me feel better. So I'm really happy to hear that. Thank you so much to our panelists for helping this group of very important and special people feel just a little bit better in this crazy world. So thank you, everybody. Have a great night, and we'll talk to you again soon.